we are losing over 60,000 people a year because they don't get to a doctor on time. But in addition to that, from a financial and cost-effective perspective, what we have now is basically insane. We have a situation where when people get sick, they don't go to the doctor. And you know what happens when you don't go to the doctor and you're sick? You get sicker. And maybe you end up in an emergency room where the cost of primary care is 10 times or 8 times more than it is if you walked into a community health center. And if you can't afford prescription drugs, you get sicker, and you may end up in the hospital at a cost of $100,000. Tell us a little bit about what happens in rural America when people have no hope, no access to health care they need.
Yeah, it's a great question. I mean, deaths of despair is kind of what it describes, right? You see worse chronic diseases, substance use disorders creeping in, particularly in the county I grew up in, as manufacturing jobs left. And without access to care, mental health care, substance use disorder treatment, those things get worse, and they get worse quickly.
We are the richest country in the history of the world. We now spend twice as much per capita on health care as any other people. In your judgment, is it in fact too much to ask that every American at least have access to quality primary health care? And as Senator Cassidy mentioned, that includes dental care, mental health counseling, lower cost prescription drugs. Is that too much to ask in the United States? We spend over 18% of our GDP on health care. That is almost double what any other country spends. And as broken as our general healthcare system is, it seems to me that our primary healthcare system is even more broken, with tens of millions of people not able to get to a doctor when they get sick. And I have talked to physicians in Vermont and around the country who tell me that people walk into their offices very, very sick, and sometimes with incurable illnesses that could have been dealt with if they walked in the door on time, and they didn't because they didn't have insurance. They were embarrassed not to have any money to pay. So we don't talk about it very much, but studies that I have seen suggest that we lose over 60,000 people a year who don't get to a doctor on time, and that if we don't treat people, you said it, an ounce of prevention is better than a pound of cure. Are we spending on the cure, the tertiary health care, the $100,000 surgeries, rather than making sure people have the medicine and the primary health care they need?
If you keep them from getting severely ill, which you can do in health centers, yes, it is going to serve, and it is meaningful for the 100 million people that we've called out today, but really for everyone. Primary care is the path to success in healthcare, period.